Hi, I'm Emma and I'm covering Sam's presentation of the case.
I'm Georgia and I'm covering the pathophysiology.
I'm Chloe and I'm covering the pharmacology.
I'm Ari and I'm covering the nursing interventions.
And we're doing the renal case of acute glomerulonephritis.
Alright, I'll just give you the handover on Sam now. So Sam Brown, he's a male, he's 50 years old and lives with his wife but doesn't have any children. He's overweight, smokes 1 to 2 packs of cigarettes a day, and he's a type 2 diabetic. When Sam was admitted, he complained of abdominal pain, decreased urine output, nausea and vomiting. His urine was foamy and presented with blood. He had noticeable edema on his ankles, face, hands and under his eyes, and he also complained of experiencing regular headaches. When he was younger, he had appendicitis, but he has recorded no other major health issues. He had strep 1 to 2 weeks ago, but didn't finish his course of antibiotics because he was feeling better. Since the infection, he's had slight weight gain. His current presentation includes a heart rate of 96 beats per minute. His blood pressure is 162/100, which is moderate hypertension. His temperature is 38.5 degrees Celsius. His urinalysis has shown hematuria and increase of leukocytes, and his blood test has shown anemia and hyperkalemia. We're just waiting on the results of a couple of other tests that the doctors have ordered.
Okay, great. I'll go read them now. Hi Sam, I'm Ari. I'm your nurse for tonight. Can I please check your ID band?
Yep, sure.
Glomerulonephritis pathophysiology, presented by Georgia. As the kidneys filter the blood, kidney degeneration, disease or failure directly impacts on other organs in the body and homeostatic control. Let's take a look at the structure and function of the kidney. The renal artery supplies blood to the kidneys, and opposing pressures drive blood to be filtered through the capillaries, forming filtrate, then urine. Specifically, the afferent arteriole supplies blood to the glomerulus, with the efferent arteriole carrying blood away from the glomerulus. The efferent arteriole then forms capillaries that intertwine around the tubules in the nephron, known as peritubular capillaries. Key to normal kidney functioning and urine output, glomerular filtration rate, or GFR, is clinically significant. This is the steady, regulated blood flow through the kidneys, allowing for fluid balance in the body. When GFR is too fast or not fast enough, urine output is disrupted, and the body's fluid is therefore compromised. Consequently, appropriate constriction and dilation of the afferent capillary is significant. Now looking at the glomerulus, its structure is a network of blood capillaries contained within the Bowman's capsule of the nephron. It is the site of primary filtration of waste products from the blood into the kidney tubules. 3 key filtration sites are within the glomeruli: the capillary endothelium, the basement membrane, and the foot processes of the podocyte. Keeping the background pathophysiology in mind, we can now explore how glomerulonephritis affects not only the kidneys but also fluid balance and consequently the entire body. Glomerulonephritis is an inflammation or attack on the glomerulus, arising from a variety of primary and secondary causes. In this presenting case, Sam's infection is due to a secondary cause of strep throat. By definition, glomerulonephritis is when immune complexes activated from the inflammation cannot cross the basement membrane of the fenestrated epithelium and are trapped. Furthermore, leading to an accumulation of neutrophils from the immune complexes, complement is released, further exacerbating the inflammatory response, ultimately damaging the delicate endothelium and epithelial cells of the fenestrated capillaries and the basement membrane of the glomerulus cell walls. Normally, the glomerulus is the site of primary filtration of waste products and fluid that does not need to be reabsorbed into the blood. As our patient had a strep throat infection and didn't finish the course of antibiotics, it is believed the infection got into his blood and has travelled to the kidneys. A cascade effect of infection now occurs for the patient. The antigen-antibody complex in the blood has travelled to the glomerulus, where an immune-mediated reaction is occurring in the glomerular basement membrane. The now proliferated cell wall leaves the filter subject to passive transport of macromolecules, such as proteins and red blood cells, substances previously too big to pass through the membranes. These usually large substances cause damage to the renal tubules and can cause adverse effects to occur to urine formation and blood composition. Simultaneously, the proliferation of the cell wall decreases glomerular blood flow and therefore GFR, a crucial criteria as previously discussed for effective blood filtration. Now knowing the pathophysiology responses occurring as a result of the infection, we can now explore the clinical significance of the presenting symptoms. Considering homeostasis, declined kidney function is clinically significant for the nurse. The patient is presenting with blood in the urine, known as hematuria. This is due to the damaged fenestrated capillaries and basement membrane in the glomerulus, due to the antigen-antibody complex releasing complement. Blood is an abnormal characteristic of urine, and as the patient's urine is bright red, it signifies acute active bleeding. If left untreated, the patient's anemia may become worse due to long-term unmanaged blood loss. There is also low amounts of protein in the blood, including the protein albumin. Conversely, high amounts in the urine. This is known as nephrotic syndrome. Protein once too big to transport through the fenestrated capillaries remains in the filtrate and then in the urine due to the damaged pores. There is also elevated white blood cell count in the blood due to the body's active immune defense mechanisms. Similarly, an increase in temperature, that being 38.5 degrees. As the patient has declined kidney function, they are at risk of blood acidosis due to the kidney's inability to remove the body's byproducts. This is because the kidney usually reabsorbs hydrogen ions and bicarbonate. These wastes accumulate in the blood at abnormal levels and cause acidic blood pH. Likewise, high levels of creatine are also present in the blood, indicative of the kidneys not being able to remove wastes effectively. Due to an increase in fluid retention, there will be a decrease in GFR. This will see a decrease in renal blood flow, and therefore the patient is consequently presenting with oliguria, or decreased urine output. Simultaneously, due to a decreased reabsorption of ions such as sodium, we will see fluid retention. The body is insufficiently removing fluids and ions. Therefore, the fluid is forced from the plasma into interstitial space due to hydrostatic pressure. Simply, the fluid has nowhere else to go. This is why the patient is presenting with swelling and edema. In addition to edema, the patient is experiencing hypertension due to fluid retention, as the kidney's inability to discard fluid is compromised. Blood volume is increased and therefore blood pressure is increased. Long-term untreated fluid retention puts significant pressure on the cardiac system and puts the patient at risk of cardiac failure. Ion imbalances, including hyperkalemia, are also occurring due to a decrease in potassium excretion from the kidneys. Finally, as the patient is a diabetic, this is a significant risk factor to the presenting case. The patient is at risk of diabetic nephropathy, that being the long-term damage to the kidney, resulting in leakage of proteins into the urine, ultimately damaging the renal nephrons. Upon treatment of the current glomerular nephritis, the patient should partake in regular urinalysis to monitor protein levels in the urine and detect and manage potential renal failure. Early intervention is in the best interest of the patient, based on their comorbidities. To conclude, potential and actual complications for the presenting patient include increased cardiac stress due to increased fluid retention and hypertension, electrolyte imbalances and homeostatic imbalances, further infection and deterioration, anemia, edema, proteinuria and hematuria, renal failure, and diabetic nephropathy in the future.
This medication that can be given to Sam is a loop diuretic such as furosemide. Furosemide can be used to treat Sam's fluid retention and to remove excess fluids and edema. Contraindications of taking furosemide include hypertension, dehydration, and severe untreated hyperkalemia, hyponatremia, or hypovolemia. Side effects that Sam may experience when taking furosemide include fluid and electrolyte imbalance, dizziness, headaches, hypotension, GI upset, vertigo, and jaundice. Safety considerations and nursing management that the nurse needs to consider while Sam is on this medication include monitoring Sam's fluid intakes using a fluid balance chart, monitoring for symptoms of electrolyte depletion or imbalance, monitoring Sam's blood pressure for hypotension, and encouraging Sam to have with food to minimise stomach upsets. Another medication that can be given to Sam is an antibiotic such as amoxicillin. Amoxicillin can be used to treat Sam's underlying infection caused from the strep. Contraindications before taking amoxicillin that should be considered for Sam is if he is allergic or has any hypersensitivity to penicillin. Side effects that may be experienced by Sam when taking this medication include hypersensitivity, such as severe skin reaction and anaphylaxis, GI upset, nausea and vomiting, diarrhea, fever, and becoming lethargic. Safety considerations and nursing management that the nurse needs to consider while Sam is on this medication include monitoring for any signs of reactions, such as rash or fever, not giving it to Sam if he has a hypersensitivity to penicillin, skin assessment, and administering antiemetics if nausea does occur. Another medication that became given to Sam is an NSAID such as diclofenac. Diclofenac can be used for the acute inflammation of the kidneys as well as any pain Sam is experiencing. Contraindications before taking diclofenac that should be considered is if Sam has any stomach ulcers, GI bleeding, or is asthmatic. Side effects that may be experienced by Sam when taking this medication include headaches, dizziness, vertigo, GI upset, rash, stomach ulcer, or increased blood pressure. Safety considerations and nursing management that the nurse needs to consider while Sam is on this medication include encouraging Sam to take with food to minimise gastric upset, monitoring for any signs of stomach ulcer, perforation, or hemorrhage, and a pain assessment for the patient after administering the medication, as well as monitoring Sam's blood pressure. Another medication that can be given to Sam is an ACE inhibitor, such as perindopril. Perindopril can be used for Sam if his hypertension is not treated from the furosemide. Perindopril is an ACE inhibitor used for hypertension. Contraindications with taking perindopril that should be considered include renal dialysis, diabetes, angioedema, or hypersensitivity to perindopril. Side effects that may be experienced by Sam when taking this medication include hypotension, headache, dizziness, GI upset, visual disturbances, muscle cramps, and dysopnea. Safety considerations and nursing management that the nurse needs to consider while Sam is on perindopril include monitoring Sam's blood pressure to ensure he doesn't experience hypotension, encourage Sam to take perindopril with food to avoid GI upsets and minimise muscle cramps. When administering these medications to Sam, the nurse needs to take into consideration of the NSQHS Standard 4 of medication safety, which will include acknowledging the nursing scope of practice of administering and monitoring the medications while considering and prescribing and dispensing of the medication is correct, as well as accurately documenting medication history and passing it on to other clinicians when needed.
Patient education. The more Sam understands and takes initiative of his health condition, the greater the chance he can minimise any potential risk factors and lead a healthier lifestyle. This can be achieved by teaching regarding the disease process of acute glomerulonephritis and what to expect, how to identify early signs and symptoms to reduce or avoid acute episodes, when to seek emergency care. For example, if Sam starts putting out less urine than normal or if urine is abnormally dark, unusual swelling, particularly around the eyes, legs or feet, and any symptoms that suggest signs of possible kidney failure, lifestyle changes and reduction of risk factors. The nurse can explain to Sam how his current lifestyle choices, such as smoking or carrying excess weight, may affect his current condition. Medication information. Educating the patient on the time, dose, frequency, and indication for safe and effective medication administration. Encouraging non-strenuous exercises and ambulation. This is important to increase blood and fluid circulation to reduce edema. And dietary restrictions, encouraging Sam to follow up with a dietitian. A dietitian can help create nutritional programs based on the needs of the patient and may also further counsel Sam on how to lead a healthier lifestyle supportive of his condition. Standard 2. Partnering with consumers. An intention of the nurse involving Standard 2 would be to involve the patient's wife and other allied health professionals, such as the GP, dietitian, nephrologist, and physiotherapist. Tests. Procedures to determine the etiology of the kidneys and their functioning, and to establish the best treatment method for Sam and whether his condition is stable, in decline, or responding well to treatments. Blood test. To determine kidney and electrolyte function and any supplements that may need to be administered to compensate for lowered electrolyte levels. These may include full blood count, complete blood count to test for anemia, creatine. In proper functioning kidneys, creatine is filtered out of the blood. Any remnants in the blood may suggest a decrease in kidney function. Blood urea nitrogen. High levels of this reflects the decrease in glomerular filtration rate. IgG-A to test for chronic or acute infections. C-reactive protein and erythrocyte sedimentation rate are both markers of inflammation. Potassium. Hyperkalemia reflects insufficient functioning of the kidneys. Anti-streptolysin O titer to determine whether a recent streptococcal infection may be the cause of acute glomerulonephritis. A liver function test, iron and sodium levels can also be tested for. One of the first tests to be conducted is a urinalysis. Further testing is then prompted on the basis of these results, to be conducted daily on the ward or as required. The test indicates the presence of proteinuria and hematuria. Blood in the urine indicates the insufficient functioning of the kidneys and protein or red blood cells leaking into the urine. A urinalysis may also show leukocytes, high acid levels, and a mid to high range values for specific gravity. A 24-hour urine collection may also be used to measure proteinuria. Blood sugar levels should be checked and monitored, as blood glucose levels may be high as the kidneys are unable to filter excess sugars out of the bloodstream. Renal ultrasound. A scan of the kidneys to give information on the size and appearance and any possible blockages. A streptozyme test and cultures of the throat and skin to show evidence of the Streptococcus bacterium. Renal biopsy. Renal sample for microscopy and immunofluorescence to determine the etiology of the condition, the specific location, and the severity to determine the best course of treatment. If any renal disease or abnormalities are confirmed, Sam may be referred to a nephrologist to help deal and manage his condition and any fluid or electrolyte imbalances. Rest and inactivity. Rest is essential in acute glomerulonephritis to help alleviate any strain put on the kidneys, allowing them to heal naturally. Any exertion on the body can worsen the acute phase and increases the risk of hypertension and ascites. Bed rest helps in maintaining adequate blood flow to the kidneys and helps to facilitate diuresis to reduce the risk of fluid overload. Rest may be achieved through uninterrupted sleep and allowing rest periods between and after activities. Decreasing the intake of sodium and protein are also recommended. A physiotherapist may be involved in Sam's care to help reduce edema through lymphatic massage and increase circulation and the distribution of fluid through non-strenuous exercises. Monitoring fluids. When the glomeruli are inflamed, they are unable to remove waste products and fluids from the body effectively. This allows for salt and excess fluid retention in the body, which may lead to complications such as edema and a high blood pressure. To compensate for fluid retention, putting Sam on a fluid restriction assists in preventing further fluid accumulation while there is a decreased glomerular filtration. Limit intake on sodium, potassium, and protein. Due to fluid retention, there is a buildup of these nutrients in the blood, which may affect normal heart rhythms and increase the risk for cardiac failure. Monitoring Sam's daily weight to measure fluid retention. Assess for adventitious breath sounds, which may suggest possible progression of fluid into the lungs. Administering prescribed medications such as a diuretic to reduce fluid retention. Keeping an up-to-date fluid balance chart to monitor input, output, and replace fluids according to the patient's fluid losses. Record timely documentation of all findings to assist in patient progression and handover. Blood pressure. It is important to monitor Sam's blood pressure regularly. The patient's reduced glomerular filtration rate, as well as salt and water retention, results in an increase in blood volume, leading to hypertension. Monitoring blood pressure and seeing a decreasing trend can be an indication that medication or treatment is working. If hypertension is left untreated, the patient is at an increased risk of edema, renal failure, and cardiac failure. If hypertension is left untreated, the patient is at an increased risk of edema, renal, and cardiac failure. Putting Sam on a fluid restriction and reducing salt intake will help relieve water buildup in the body.